Hi, I'm Dr. Mike Milligan. We are here at the founding meeting of the American Academy for Oral Systemic Health. I'm here with the founder, Dr. Chris Kamer. Chris, thanks so much for being with us.
Mike, it's a pleasure.
Chris and I go way back. We've been very good friends for a long time.
Yeah, that's true.
And we spoke about this many years ago, founding this organization.
I remember you and I and Ron Schefter sitting around with a passion for nutrition, for a passion for stopping gum disease in people's mouths as we were learning that it affected whole body health.
Right.
And we said, hey, shouldn't we should probably get some organization going. So this idea for this organization has been bubbling under for a long time. Right. And we talked about it many years ago.
Right. Absolutely. And your father founded the American Academy of Cosmetic Dentistry.
Yes, correct.
So you've got that in your blood.
I must. Yes, and it's amazing, sometimes you don't know how much maybe you are like your father, and I don't necessarily feel like I need to be exactly like my father, but I've kind of fallen into this, but it was a good thing. I've been inspired by the things that he's done.
You bet.
And he helped me believe it was possible to do an amazing thing with an idea.
Right.
And when you feel passionate about something and you know something needs to happen, like an organization where like-minded people that care about the oral systemic and all the new things about oral systemic health, it was time to get it together. We talked about it years ago, but here it is today.
And there was a big wave with cosmetic dentistry, and it became a very big organization, and we've helped so many people in so many ways with that.
Absolutely.
And now this is even bigger. This is affecting people's lives and the quality of their lives in such a significant way. The American Academy of Oral Systemic Health.
It's mind-blowing because I didn't think I was getting into the life and death business, becoming a dentist.
Right.
And yet it is becoming more and more of that every day. Every time I look at my computer, another study is coming across with a new connection for oral disease affecting another part of the body or another disease. And it makes perfect sense, and it makes sense to the average person too, which is nice, because they go, well, I'm thinking if it got an infection here, it could travel to here or here or here. Right. So it makes
the largest source of infection in the body is bleeding gums, because of the surface area of those gums.
Guinness Book of World Records.
That could be a sore that big on your arm that you're just pounding bacteria into. If that were on your arm and you could see it, you'd do something about it.
It's funny. Oh, you absolutely would. And it's funny how people just think their mouth is clean, like even how people will clean off a pacifier for their child with their, by licking it, because just hit the floor, licking it off, and it's like, oh, you just put your bacteria into your cavity-causing, disease-causing bacteria into your child. It's it's a transmissible disease, and it's going on in people's mouth. There's more bacteria. There's hundreds of different types of bacteria in the mouth. Right. I think that we think that, and it's a kind of a silent disease too. So for a long time, people just thought, a little gum bleeding was okay, and it doesn't really matter. I still feel pretty good. Right. But there's an inflammatory burden going on with that gum disease that people are starting to understand, and it's taken a toll on our bodies. And that's what we're here to tell now. I mean, it's a big story, and it's no easy task.
Oh,
it's a mountain to climb. But the thing is, we're going to take that a step at a time, and it's doable, and we've all done it. And the coming together of like-minded individuals where everyone has done a little bit of that in their own community or own town, we're going to share those success stories. We're going to hold high the physicians that are already counting on dentists for clearance, and we're going to learn from them what information do they need and what helps them work with a dentist. I mean, we're just coming to the table saying, how can we help you, medical world? We're here, and we know that you need us. We want to help you.
Absolutely, and this has gone from the United States General Surgeon Office.
Surgeon General. They're the ones that have alerted in the report on oral health, which came out by now. It's almost a decade ago, but even then they said 80% of the population has gum disease. I mean, so we're sitting on this powder keg that if we don't get it under control, lives will be lost. And it's not that because you have gum disease you're going to die, but what's happening, just to make it a little bit easier to understand, is it's shaving years off people's lives. It's shaving the quality of life. It's reducing the quality of life. Right. But it does it in a sneaky way, because nobody really ever thought it was coming from the gums, or that the gums contributed to that heart attack or that arthritis, or making that diabetes so bad.
Stroke, cancer,
stroke,
everything.
cancer, yeah.
7 times more likely to get a stroke, 3 times more likely to have a heart attack. It's just enormous.
Yeah, and so finally we are addressing it and coming together for the best health of the people that we serve, and that's exciting. It's exciting being here at a time when dentistry is about to become, I think, more important than it ever has been ever before.
Without a doubt.
And it always was important, but we just didn't even know how important, and now we know.
That's right.
So now that we know, we have to act.
Absolutely.
And we have to come together, and that's what the American Academy for Oral Systemic Health is all about, which is the founding meeting that we had here in Madison, Wisconsin.
Right.
And it's been exciting, and I am energized, and I'm excited, and I can feel it growing in our profession, and as we reach out our hand to the medical world, we're starting to get our hands held, and that's just so exciting. And even dental societies are, and state dental organizations are now starting to share that message. The good news is that most people have heard the message.
Oh, you bet.
A little bit.
It is. I spoke on this for many years.
You've been speaking on it for many, many years.
Yes, I have. and there is a lot of literature out there for the public mouth and the body.
It's getting out there, and that's and our job, we want to get it out there even more.
You bet. Now, how do we find out more information?
To find out more information, to join the organization, the American Academy for Oral Systemic Health, we have a website, and it's AAOSH.com. Come to the website. We're holding meetings throughout the year, so we will have live lectures and scientific sessions. We also want to get into training on the web, so there will be ways you can learn. If you can't make the meeting, it's okay. We want to get information on the web. We want to create the templates that you need to be able to speak to your local Rotary group, or even the physicians in town. Right. We want to give you the tools you need to create to share that message. Absolutely. And also it's a huge message in the media as well. So if we can help you help your community, that's what we exist for. And so contact us on the website, AAOSH.com.
Great. Get involved with this. This is so significant. This is the new wave. This is the next wave, big wave in dentistry. This will be huge.
So yeah,
get involved.
It's exciting. I mean, we are oral physicians. That's what's happening. That's where we're at these days. That's exciting for the profession because it's going to re-energize the profession, a whole new respect for the profession, for being the lifesavers that we are. And what's also exciting about it is that young people are now going to be looking up to their dentist, wanting to become dentists. Dentistry is going to be looked at in a whole new light, and what a thrill that is. It's a thrill to be here at this time in the world, and it's a great time to be a dentist. So check out all the excitement and check out how you can help the world be healthier and live longer. AAOSH.com.
Chris, thanks so much for being with us.
You're the best, Mike. Love you, buddy. Thank you. Thanks for sharing the word.
You bet.
Mouth and the body.